The World Health Organization needs more money for tools to fight the COVID-19 pandemic to the tune of $28 billion. A senior official at the WHO on Tuesday said the organization is looking at new ways to help fill this funding gap.
Yesterday, we had a meeting of what we call the ACT Accelerator Facilitation Council. This is the council that really looks at how do we ensure the political choices necessary, the really difficult choices to, number one, ensure this thing is financed. We have a financing gap of $28 billion to get those tools out, developed and out next year.
The WHO and the GAVI Vaccine Alliance have collaborated to speed up the production, development, and access to COVID-19 tests, drugs, and vaccines through a fund known as the Access to COVID-19 Tools Accelerator. The vaccine pillar of the act, called COVAX, would ensure the entire world, including low-income countries, have fair access to the COVID-19 vaccines. But financing the initiative has been a challenge as countries grapple with their own economic problems during the pandemic.
I think the information is available. I think it's a challenge for people to finance it. It's a real challenge in today's fiscal environment, despite the fact this is the best deal in town, no question. This will pay itself off within 36 hours once we get international travel and trade mobility moving again, as all of you can well appreciate. A working group looked at all the financing instruments that are out there, special purpose vehicles, concessional loans, the catastrophic bonds, social bonds, all of these different instruments. And so there's a huge piece of work going on right now with the G20, G7 to try and look at how can that financing instruments actually be used. There's also a very hard look at stimulus financing. G20 countries have put about $12 trillion into their economies, about half of that almost in cash, to try and address the consequences of COVID-19. But, as you will have seen, and I thought the CEO of Pfizer has done a great job where he's come out publicly and said, look, we're committed to making sure that our product sees global use. And we recognize that, that requires pricing it at the right level to be able to make that work. So there's a strong commitment out there from Pfizer to do that.
Earlier this month, WHO Director General Dr. Tedros Adhanom Ghebreyesus spoke about equitable vaccine access and distribution to impoverished countries.
We simply cannot accept a world in which the poor and marginalized are trampled by the rich and powerful in the stampede for vaccines. This is a global crisis, and the solutions must be shared equitably as global public goods, not as private commodities that widen inequalities and become yet another reason some people are left behind.
The ACT Accelerator was set up last April. Alexia Capralos, Global News.